Okay, today we're going to do a full head-to-toe assessment on our client who is a 21-year-old male with a BMI of 19, which is inside our normal limits. All of his vital signs were inside of normal limits and his health history is unremarkable. So as we go through the assessment, head-to-toe is a little different as far compared to a focus assessment because we're assessing an overall feel of the patient's health. So I'm just going to start by observing the patient's posture. I'm looking for symmetry, and when I converse with the patient, I'm also paying attention to any neuroscience that I see or any different psychosocial issues that may arise during our conversations. So I'll first, ask, what's your name?
My name is Mikhail Harkin.
And do you know where we are?
We are at the hospital.
I'm in the hospital in the room, that's fine. And do you know what today's date is?
Today is August 20th, 2023.
Okay, so we can assess that our patient is oriented to person, place, and time. And I'm going to just go ahead and start with my assessment with the looking at his head. I'm looking for overall symmetry. I'm going to feel the texture of the client's hair to feel for any realness. Have you noticed any hair breakage or like bald spots? So I'm just going to observe for any lesions, and then I'm going to also palpate your head to feel for any masses, lumps, and symmetry. So now I'm going to continue looking at the head and would start with the patient's eyes. We would do a Snellen test to test for acuity. Do you wear glasses or contacts?
I wear contacts.
Contacts. So we would do that with the contacts in if we felt there was a need. I do not have my ophthalmoscope and an otoscope, but I would typically have the client look, and I'll use my pen light for now. So we're gonna test your eyes for pupil reflex. Look over my shoulder, starting on the side, and we're gonna shine the light and just on one side and then the next. And we're looking for pupils constricting and accommodate with each other. Now I'm going to do some neuro assessment on the eyes, testing the cranial nerves. I'm gonna have you follow my finger and don't move your head, just follow my finger. So we're assessing for any nystagmus, following, looking for any jerking moments, up and down, side to side, and then they converge. So the cranial nerves on the ocular nerves are all intact. And I'm going to also ask the client to pull your conjunctiva so I can see the color. This is a spot we can see for any discoloration in the sclera, and look for any discharge, which I don't see any signs of discharge or running or watering. So we'll go ahead and move on to the nose. Do you have any allergies or sinus problems that you're aware of?
Sometimes in the spring I get a little stuffy, but
seasonal.
Really
Okay. And so if we did have any concerns, we're going to go ahead and take a look. And I'm going to shine my pen light up. I can see nice clear turbinates. I don't see any discharge or any deviation of the septum. Let's see. I'm going to also just palpate your sinuses. Tell me if you feel any pain when I press. No pain?
No pain.
Okay, great. And then we could also test the olfactory nerve. If we had something to smell, you would plug one side and I would tell you, what does this smell like? If it was an orange, you would reply. And then we would plug the other side and test. Normally we don't test that nerve, however. Next we can go on to the ears. One simple test for hearing acuity is the whisper test. So I'll plug this ear and just whisper a word and you're gonna repeat it.
Cat.
Very good. Whisper on this side.
Dog.
Okay. And again, I don't have my otoscope, but I did it in my first head-to-toe assessment where we would want to first ask if you have any pain or discomfort anywhere around your ears.
No.
And then I would palpate and feel for any lumps or any tenderness. Nothing here?
No.
While I'm palpating here, I can also test for any TMJ and have the client open the jaw and close it and feel for any clicking. If I had my otoscope with me, I would pull up on the ear and take a look at the tympanic membrane on both sides, while I also check the outer ear for any signs of redness, swelling, or discomfort, discharge, earwax impaction, or any of these things. So moving on, we're gonna go to the mouth. I'm gonna have first just assess the client's coloration of the mouth, look for any like blue lips or anything that would alert me to any issues. And then I'll have the client open his mouth. And as I look, I can say, stick out your tongue and say, ah. And so I'm looking at, you can close. So when I look in the mouth, I'm looking at the client's tonsils for any exudate or discharge, which is clear. They don't have any swelling either. I also want to make sure that the uvula is raising symmetrically. If it wasn't, that would give me an indication that there may be some nerve damage. He also had the soft palate raise evenly. I was able to look at his gums and see color, moisture, and if there was any lesions or dentition problems. Sticking out your tongue, test his vasovagal nerve, and well, go ahead and just keep working our way down. I'm going to palpate for your cervical lymph nodes. So I'm going to come behind you. You tell me if you have any pain or discomfort as I palpate. So these submandibular lymph nodes, I don't feel any swelling. Just if anything hurts, you let me know.
No.
You don't feel cervical. Typically in adult, they are not palpable. So we'll feel for any lymph nodes here. And then I'll have you just swallow. And I'm also looking for any tracheal deviation. And everything looks good. So we'll go ahead and keep continuing on with our assessment. We can do your respiratory. Do you have any asthma or anything that you're aware of?
No asthma.
Okay, so I'm going to listen to his lung sounds. Okay, nice breath. Okay. So as the client's breathing, I'm also watching for any signs of distress, any retraction, any nasal flaring. I'm watching for symmetry as the chest expands. I've also just looked to make sure that we don't have any signs of barrel chest. I'm looking at the symmetry there. I'm gonna listen to your back, the sounds on your back. Okay, all of the lung sounds are clear. Some other assessments that will go with a respiratory assessment, especially if the client was a smoker or has any history of COPD, is I would look at the client's fingers for any signs of clubbing, which this client does not have. While we're going through the assessment, I'm also making sure to note any skin assessments that I see. So as I look at this client, he has a nice skin tone. I don't see any scars. I don't see any abnormal lesions. If I did, we would definitely want to educate the client on what to look for. Any lesions like a mole that has asymmetry, irregular borders, dark blue or black in color, or if it's rapidly changing and growing. Those are something you would want to definitely let your practitioner know. And these are all things that I'm looking for as I do the entire head to toe assessment. Skin and lymph nodes go through the whole body, so we do that as we start from the head to the toe, the whole way down. So now I'm going to go ahead and I'll have you turn around so I can just demonstrate how we test for symmetry when the client's breathing. I might actually have you just stand up. Sorry. Normally I would have I'll turn you all the way around. I'll be able to check. So I'll put my hands underneath your back and have you just take a breath. And I'm watching my hands rise and making sure that they're symmetrical, which they are. So you can sit back down and pretend that I came around you. So now we can go ahead and move on to the cardiovascular assessment. We can ask the client if you have any cardiovascular problems that you didn't discuss in your initial assessment.
No.
So I'm going to listen to all of the client's heart sounds, starting with the atrium, pulmonic valve, Herb's point, tricuspid, and mitral. I had S1 and S2 in all fields. If I thought I possibly heard a murmur, I could, especially in the mitral valve, One good position to have the client bring the heart closer to the rib cage is to have the client like either lean forward, or we could have them lay down on their side. But here I would just, to demonstrate, have you lean forward a bit and tip to your side. And that way I would use the bell of my stethoscope to listen, which I do not hear any murmurs. Changing the position is also helpful in determining whether a murmur is a dangerous murmur or a harmless murmur. So as far as cardiovascular goes, we can also use the client's fingers by checking capillary refill to see how quickly the blood refills after we press the finger, which should be less than 2 seconds, and it is. Then I'm also going to feel the client's pulses and assess for a 2+. And also I'm assessing for symmetry and rhythm, which you have a regular rhythm, 2+ on both sides. We would also want to assess the client's carotid arteries one at a time as to not make them pass out. And then in an older client, I would listen for any bruise over the carotid arteries. Which I do not hear. And then while we're on cardiovascular, I would also check the client's ankles for any signs of swelling, where if there's any pooling or any shiny skin that would give me an indication of peripheral vascular disease, any lesions or ulcers. I would also want to feel pedal pulses to make sure they're present on both sides, which they are, and they are both equal +2. And then again, cap refill on the toes, just pinch, make sure the circulation returns. And then you can also ask the patient, do you ever have cramping when you're walking in your calves, or any pain,
No.
tingling or numbness in your toes? For some clients, that would also be an indication of possible like diabetes if you were having peripheral tingling and neuro problems. Since we seem to be good, we'll move on to, I'm gonna have you lay down, we'll do the abdominal assessment. And so I'm just gonna first observe for symmetry. I don't see any bulging, any lumps, anything that looks out of place. I'm going to listen to bowel sounds, and then I'm also going to make sure while we're in the laying down position to listen to the aortic artery, the renal arteries, and the femoral arteries for any bruise. So bowel sounds in all 4 quadrants, no notable bruise over any of the arteries. So now we'll move on to percussion to assess for any misplaced dullness. So I'll just any pain. So after we percuss and we don't hear any dullness or any tympany indicating like gastric bubbles, we can percuss, or palpate. I'm going to first lightly palpate for any superficial masses. I don't feel anything. So then you can palpate deeper, any pain or tenderness. So you can feel for the liver underneath the right rib cage. You can assess for the spleen by pressing up and pressing down under the left rib cage, which is normally not palpable, and could indicate, if you feel pain there, could indicate a problem with the spleen, possibly surrounding organs. Everything looks good abdominally, so we can have you sit back up. And we can do a little neuromuscular assessment. So I'm going to have you press against my hands. That's going to assess for your muscle strength and also the proper working of your cranial nerve 11. With the musculoskeletal, I want to make sure that the client has full range of motion. So if you can just pull your arms out and then round. We're just looking for strength, and one way to assess would also be to have you press against my hands up like you're doing a curl. You can feel this client has +5 strength. We also, for the musculoskeletal, sorry. I think one of the kids was locked out. I'm also looking at the bone joints of the client's hand. So when you flex, I'll feel for any clicking. Also, when I'm in this position, I can feel for lymph nodes in the epitropial area and test for reflexes. So it's a little bit of a neuro assessment as well. Here. Okay. Sorry, they're out there. And then let's see. Let me test the other side. Very good. Do you want to check and see if that's good? It's the laundry machine. Okay, that's good. At least we know that. Thank you. All right, so go ahead and I should have had you while you were laying down. I'll check your strength on your knees, so you can straighten your legs for me, and then back, and lay back down one more time. We can check your knees for any signs of clicking. So I'm just gonna lift your leg up. Do you have any pain when we lift?
No.
So I don't feel any clicking. Clicking here. And then we can also have you, sit back up. And we can test the strength of his ankles. So go ahead and press against my feet, hands with your feet, and then the other way up. All right, very good. So to complete the musculoskeletal, I'll have the client stand up, and we'll assess the client's gait. This is also part of the neurological, seeing if there's any shuffling. So I'll just have you, if you can walk to the corner and back, we'll watch your gait, symmetrical and smooth. Okay, very good. And now we can also test, I'll have you stand right back here. So we can test your balance. So I'll have you close your eyes. We're gonna do the Romberg test with our client's eyes closed and hands at his side. He's not drifting and he's not leaning, so we're not worried about that. You're actually very good at this. Another thing we can test for is his balance. You can have him lift your foot on one side and then put it down, lift on the other side and put it down. Okay, very good. We'll finish the musculoskeletal. I'll have you touch your toes. Wow. And then bend side to side and to the back. So this is testing his range of motion of his spine, which is very flexible. You can, while we're here, as part of the GU, I would also ask for any test for any kidney tenderness. Let's see, costovertebral angle, any pain?
No.
Nothing on this side?
No.
Okay, and then you can have a seat. So for this patient, because he's a male, I had my female client for the genital assessment, so the male would be quite different. We would have the client stand up, assess for the testicles descending equally, if any asymmetry exists. We would also palpate each of the testicles for any lumps, and in between, if we felt a lump, we could take our pen light and shine it through the testicles in order to see if it's clear or if it's solid. This is part of the general assessment. We would also just test for any inguinal hernias, which you could see like with the patient. If there was any asymmetry when we had the patient bear down, you would be able to usually see a hernia. You could also test by feeling. And then the rectal exam would be a little different than a female in that you would have the client, you would be feeling for the prostate, which you won't have in a female. So you would feel for the anterior wall, any bogginess in the prostate or any hard lumps that don't move. You would also be assessing for any lesions or rashes. You would ask the client about their sexual health history or any incontinence problems or things like diarrhea, constipation, and such. And then throughout this whole exam, we've been assessing the neuro on the patient by observing. We can also have the client take their hands and kink like this, and that's going to test the cranial nerve or the nerves as well. For discrimination, if I have something, do I have anything sharp? I would have the client close their eyes and tell me if they feel something soft or sharp. Give a poke.
Soft. Sharp.
Okay, that's pretty good. So you could use that or a cotton swab to test. When we're speaking with the client, we can test the cranial nerves by having the client frown with your eyebrows and happy. And can you blow with your cheeks like this? Good. So as far as what we have here is a very healthy client who has been very cooperative, and I think for his time.
Yay.
All right, thank you.
You're welcome.